Next, gel is applied to the index and middle fingers of the gloved hand, which is gently placed into the vagina. The wrist is dropped, and the examiner palpates anteriorly to attempt to feel the sacral promontory with the middle finger. This allows assessment of the pelvic inlet and the anterior-posterior diameter of the pelvis. For a normal or wide AP diameter, the sacral promontory will not be reached. For a narrow AP diameter, the sacral promontory will be reached with the middle or even the index finger. Next, the hand is pronated 90 degrees and the curvature of the sacrum is palpated by moving the fingers inferiorly. The anterior surface of the sacrum is described as being hollow or flat. The midplane of the pelvis is examined next by slightly removing the fingers from the vagina and palpating at 4 and 8 o'clock in the mid-pelvis. The spines are described as prominent, average, or blunt. At this point, a generalized assessment of the bispinous distance can be made, which is helpful in assessing if the transverse plane of the pelvis is normal, wide, or narrow. From the ischial spines, the slope of the pelvic sidewall can next be assessed. This can be done directly by holding the internal index finger against the ischial spine and palpating the ipsilateral ischial tuberosity with the thumb. If the tuberosity is lateral to the spine, this is a divergent pelvic sidewall. If the tuberosity is in line with the spine, this is called parallel sidewalls. And if the tuberosity is medial to the spine, then this is called a convergent pelvic sidewall. Finally, the subpubic arch is examined. This can be performed by palpating the inferior aspect of the pubic bone and estimating if the arch is approaching 110 to 120 degrees, which is wide, greater than 90 degrees but less than 110 degrees, which is normal, or less than 90 degrees, which is narrow. This is the final assessment of the pelvic outlet. The initial assessment of the pelvic outlet occurs by estimating the bituberous distance. This is done by alerting the patient that you will be pressing your gloved fist against the vulva and gently applying pressure. With a normal or wide bituberous distance, the ischial tubercles will be felt on the outside 4 knuckles of the fisted hand. With a narrow bituberous distance, the ischial tubercles will be felt on the inside of the 4 knuckles of the fisted hand.